All right. Well, good evening. I'd like to call the board meeting to order, and as we always start by recognizing our country with the Pledge of Allegiance. If you'd stand and join us. Flag is over here. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Can y'all hear me? I need to put the microphone on. Can you hear me, or do I need a microphone? Microphone? There, that better? All right, very good. All right, seeking approval of the proposed agenda.
So moved.
I have a first by Randy, a second by Sarah. All in favor, aye?
Aye.
Opposed? All right, very good. Well, welcome. We've got a good crowd, so thanks for coming out. Introduce myself. My name is Ron Mills. I'm president of the Board of Education. And as always, we welcome participation. It would be nice if we had participation throughout the year, but thanks for coming tonight and being part of the meeting. As it might be the first meeting for many of you, I will kind of lay some groundwork so you know what to expect. I know most of you are here for a certain portion of the meeting. We would encourage you to stay for the entire meeting because there might be some information that would pertain to you and or your children or grandchildren, whoever you're here to represent, later on in the meeting. But you're welcome. Our board meetings are always open. We do have a board policy that I need to read just briefly a portion of. Board policy number 1480, which notes that the Board of Education meetings, they're open to the public. However, they're not considered open forums or public forums, so we don't have open mic. If you want to speak to the board, you can speak to us individually, as many of you have, either in communication with emails or calls or stop bys at some of our places of business. That's perfectly fine. But if you want to be on the agenda to speak to the board as a group, we ask that you submit that request to the superintendent's office at least 72 hours in advance. We do have a very lengthy agenda each month, specifically this month because we're getting ready to start school soon. So we have a lot of planning and decisions to get in place for that. So having said that, we do have 3 folks that have requested to speak to the board on behalf of a particular topic, all of which are speaking on behalf of a group. With that, I will call the first person up. The agenda is actually on the board for you to follow, but our first guest is Mr. Ken McGee. So, Ken, the floor is yours for 10 minutes.
Good evening. My name is Ken McGee, and I'm here to represent not only myself, but also a group of parents concerning the math topic. I'm also a parent of 6 children in the district. End of last school year, I came before the board. I listed the reasons for why a mask mandate is wrong for our children, as it is the parents' right to make the choices concerning their child's health and well-being. Shortly after there was an emergency board meeting where it was voted that masks would be optional for the 2021-2022 school year, which was the right decision, and I commend you for that decision. Especially, I noticed that you did it before the school year ended. Obviously, you know that was one of the requests that I had, at least send our children into the summer knowing they don't have to dread school. They can come to school the next year and they can see their teachers' faces and their fellow students' faces and be excited about that. Well, it was brought to our attention that masks were on today's agenda. Our concern is that the school board may decide to bring back a mask mandate policy. Now, recently, Dr. Dan Stock made an amazing presentation to the Mount Vernon School District concerning mask mandates, COVID-19 protocols in schools, He's a functional family medicine physician. He's a specialty trained in immunology and information regulation. I have listed not only a speech transcript, I handed out to each of you, but also links to the studies and science backing his claim. So for you to check out. Now, I say this, I'm not a doctor. I am a software architect. I design and build complex, event-driven software applications. When it comes to my job, I enjoy reading, learning, fact-finding. I just don't want to take one person's word on something. I want to see metrics, first-hand user stories, pros and cons, something to be measured against, user stories. Is someone trying to help me with their idea of technology solution, or are they trying to just sell me something? Masks do not work. In fact, my own research, the size of the COVID-19 molecules will go right through masks. In fact, the lower end, they vary in size, the lower end of the COVID-19 molecule, it will go right through an N95 mask. I know. March 2020, I had 1 million N95 masks. I was wearing them all the time. I didn't know, nobody knew. But looking at the facts, looking at the studies, I know, they don't work. Now, even as cases are going up, wearing or not wearing masks is not going to help. You know, CDC thinks they can handle this like they did with smallpox. You know, smallpox had no animal reservoir. This sounds crazy because I learned this last 2 months. Did you know that they tested white-tailed deer, which we know in Lincoln County? I know in my backyard. I know when it comes out in September, October, November, I'm all excited about it. They tested white-tailed deer, 40% have COVID-19 antibodies. Deer can get COVID-19, but it seems not to affect them. Now, minks, on the other hand, they can get COVID-19 and they die. Problem with their lungs and they end up passing away. Now, they don't wear masks. We can't regulate masks on deer or mink or any other animals. Common cold, influenza, these all can be transferred to animals and then back to us again. This cycle is never going to end. We can't wear masks and then, even though they don't work, and then all of a sudden say, hey, it's gone now. It's not. It's going to be a cycle. It's always going to be here. Again, I encourage you to look at the studies from Nonstop. A lot of that stuff backs up what I'm saying right now. Now, I'm not sure why they're selling the information they are, but the CDC, the Lincoln County Health Department, they're selling information that just isn't based on science. I don't know why. I don't know what their end game is. But I like to dive in and find out what is really going on. Show me some studies, something I can look at, talk to people. Again, I encourage you, stop buying what the CDC, Lincoln County Health Department is selling, and do your research. Look it up. Now, last I want to end with, on your, check here, time-wise. On your continued, that's a word I don't like very much. This thing, of service plan.
Continuity.
Yeah.
So
the
on
CSP.
Thank you very much. I like that. On page 10, you talk about quarantine for unvaccinated, vaccinated. And you say people who are fully vaccinated do not need to quarantine if they do not have symptoms. Well, I want to tell you a little story about this. So the vaccinated people can get COVID-19, and they can also share that. And you don't even know, especially because they say the vaccinated, you don't get it as bad. Well, then you probably don't have many symptoms. Did you know that this year, February 2021, the island of Fiji, it has just under 1 million people. This is my research, by the way. Just under 1 million people. They had 59 cases of COVID in February of this year. Not very many, great for them. March 2021, the vaccination was rolled out to that country. As of today, and I include the graph there and the number that I pulled from the website, it's real number. As of today, they have 37,846 COVID cases. Only thing that changed in that is they brought the vaccination to Ireland. You can't tell me that vaccinated students are somehow different than unvaccinated students. To me, you're discriminating based on a health choice that they made. And there's no basis for that. They shed as well. They're sharing it too. So I just want to On that one thing, I hope that you continue to move to the motion to amend to keep math optional. And by the way, it's good seeing your faces. I think our students are going to say the same to their teachers and teachers saying to their students. And I just want to also ask that you move and for a motion to amend this quarantine. It's not right. It's not right. It's not right to just say vaccinated or fine, and then you're quarantining students for 10 days, or 7 days if they're tested, etc. It's just, that's wrong. So that's all I have. Thank you.
Very good. Thanks, Ken. Thank you, Ken, for your time again. Technology is next up on the list. So we are being joined via Zoom by Kim Coleman. So, you ready? Should be able to hear her over the microphone.
Should be live.
Okay. Can you try again? Hold on just a second. Check again.
Okay,
Oh, there we
Yep.
go. Okay. Go ahead.
all good?
Yeah, we can hear you.
Thank you, Julie. Okay, I wanted to express my appreciation for the accommodation allowing for my virtual appearance to voice my concerns and share my family's experience. Please know that I recognize that as board members, you hold volunteer positions for which you're not paid, and I do not envy your position right now. You're charged with making the tough decisions. Sometimes the tough decisions are not always the most popular. I believe the decisions you make not only weigh on you personally, but could be impactful for your businesses or your personal relationships. And I can certainly appreciate the concern regarding unintended consequences from the decisions you make. Though I'm sure you will, I must beg that you place the decision to protect our children above the potential consequences. I grew up in this community. I graduated from Troy Buchanan High School. I graduated from Missouri Baptist University and then graduated from SLU Law School. I love this community. I'm raising my children here. It is always my goal to protect and improve this community. I have 3 children, one that graduated high school last year, one entering her senior year, and one entering middle school. All 3 of my children engaged in virtual learning last year, and after more than a year in isolation, my daughters are so excited to get back to attending in person this year. Unfortunately, my excitement is overcome with concern for the safety of my children, but also the concern for the entire community. My hope is that after college, my children and other children in the community return to serve this community and make a positive impact here. This is why education is so important to me and why it's important to this particular community. It's an investment. I want to make sure that I advocate for every child in this district to have the opportunity to safely attend in-person school. Without the requirement for math, a safe environment in school is not possible. A little more to add, my 11-year-old was diagnosed with an autoimmune disease last November in the middle of this pandemic. So her immune system does not have the same ability to fight off infections like a healthy child's immune system would. As you can probably imagine, this has been a major concern. I've spent a notable amount of time talking with my child's physicians, including her team of rheumatologists at Children's Hospital. I will be the first to admit that I'm not a physician, and I did not attend medical school. And I do not pretend to know more than the physicians that I trust to provide care for my children. As many parents do, I trust these physicians to monitor my children's health, accurately diagnose conditions when they arise, and to treat them appropriately. I've discussed COVID-19 at length with my daughter's team of physicians, and there is a clear consensus among them. Children should return to in-person learning, and that masks should be worn to ensure their safety. In-person instruction is essential for learning and preserving mental health, which is evidenced by the toll it took on my children last year to be isolated. When I shared with my daughter's physician that our district is currently not requiring masks, the look of disbelief and disappointment was quite apparent. And these physicians noted the importance of in-person instruction, but the current disregard for the safety of our children, especially with this variant, is cause for alarm. In fact, the district's current mask policy was noted in my daughter's medical records. I can imagine why, because infection in a setting where masks are not required is probable. And the solution is simple: require that the children wear masks. Infection is curbed and safety is ensured. In playing devil's advocate, I even asked myself, I said, what is the harm of wearing a mask? There is no harm. I feel like the opposition comes from a place of defying authority, but the risk to our children's lives is not worth that. Now let's all try to put this in perspective. Schools have often enacted policies to protect their diverse student body. A mask requirement is consistent with other policies that are already in place and widely accepted. For example, if one child has an allergy to a certain food, peanuts, we prohibit those foods in the classroom, therefore prioritizing that child's health over a preference to eat a certain food. We show compassion, we show concern, we accommodate. Why are we not accommodating children with disabilities or underlying diseases in this instance? We should prioritize our children's health with this simple and effective accommodation. As a matter of public policy, our community makes and enforces laws all the time. We accept that we stop at stop signs. We accept that speed limits make travel safer. We accept that seat belts save lives. We accept all kinds of restrictions on our behavior that are intended to promote safety and preserve life. This is no different. Masks save lives. In this instance, they can protect our children. In the case of my daughter, it can save her life. And if something as basic as wearing a mask can prevent our children from potential neurological conditions, this board should strongly consider this preventative measure. And I can't imagine any parent sending their child into a burning building expecting them to come out unscathed, but that is essentially what this board is asking me to do by making masks optional for my child. The fear of a child's death or permanent injury may become a reality for many parents if we don't implement the appropriate safety measures. Frankly, this is a reality for families like mine now. Even for healthy children, the risk of exacerbating or an underlying condition is very real. God forbid, one of your students becomes seriously ill, dies, or has serious developmental delays following an infection. I imagine you, board members, will reflect back on this time when you were charged with making this decision. Please make the right choice now. Several other districts have already taken a stand to protect their students and their education. Rockwood, for example, their superintendent cited the guidance from the American Academy of Pediatrics and the CDC, both filled with doctors and scientists. Here, even at the local level, our health department advises that the mask be worn. I would encourage each board member to look to the Academy, American Academy of Pediatrics, and the CDC, and even our local health department when making this decision. This decision that literally has deadly consequences. Last year, you put these preventative measures in place, and they worked. They kept children in school. The quarantine protocol was a nightmare. Not requiring masks will only intensify that disaster. Next, you'll be dealing with the backlash of that and angry parents with quarantined students. So why not prevent that up front? Last, I realize that there are other parents that support masks being optional, and there's no doubt that those parents' voices are being heard a little bit louder based on their willingness to hold in-person rallies. But please know, there are parents, such as myself, and members of this community that support wearing masks. I took the time to interview several other parents and teachers, and sadly, while many that I spoke with support masking and show that outwardly, some are afraid to speak up, and they're afraid of being personally attacked by other individuals. And in the end, one child dying is one too many, and it's just not worth it. Thank you.
All right, we have one more guest that has asked to be on the agenda. Ms. Patton, Tara?
Hi, can everyone hear me? All right. My name is Tara Patton. I appreciate you all allowing me to speak to you this evening. I am a parent in the district. My son is going to be in first grade this year, and my daughter will be joining the district next year. I am here tonight to advocate for the children of our community and to request that the mask optional policy that y'all put in place back in May, that be overturned. At the time, it likely was the right decision. New evidence was coming out that with the vaccine, the virus was spreading less, we had less outbreaks, but now, unfortunately, we do have new information, and we need to follow that. I do want to say that I am not a physician, I'm not a medical professional. My background is in education, and I like to read, I like to make data-informed decisions, so that's what I've been doing with my family. So I'm sure you're all aware, and as others have stated already, that the Centers for Disease Control and the American Academy of Pediatrics strongly recommend that in order for students to return to school safely this year, we need to have certain mitigation strategies, one of which is universal masking. Back in 2020, the original COVID strain had an R0, which R0, for anyone that isn't aware, is how contagious a virus is. It had an R0 value of 2.5. That means that one infected individual can spread that disease to roughly 2.5 people in about 10 to 15 minutes. Now, as I know you're all aware because it's a hot issue in the news, the Delta variant is here. It's not super prevalent in our county yet, but it's only a matter of time. It is spreading. The R0 value of the Delta variant is somewhere between 6 and 10. The science is still coming out on that. What that means is that an asymptomatic, unmasked individual can infect between 6 to 10 people in a time as little as 5 to 15 seconds. That's crazy. It would take under 15 seconds for me, if I were not wearing a mask, to infect countless individuals in this room. I wear this mask to protect all of you, to protect my children, in the event that I am unknowingly positive. I feel fine, but I've been vaccinated, and as Mr. McGee said, I can still pass that on. I may be positive, but because I'm wearing this, I'm hopefully keeping those around me safe. I'm asking that we require the same consideration for our students. Our kids are one of the most vulnerable populations in the county. Studies have shown that unlike the original strain, the Delta variant isn't just resulting in just mild cases in children. Children are getting sick. They're being put on ventilators, and unfortunately, in some cases, they are dying. And I know no one wants to see that. I know that we all here feel strongly, one way or the other, and we all want what's best for our kids. At the end of the day, we all do. Science has shown that in this case, at the end of the day, what's best for our kids are mitigation strategies such as masking, social distancing, sanitation, proper ventilation. So that's what's best. It shouldn't be, a tough decision, but I know that it is, and I do appreciate that you all are in a tough position. So thank you for that, and thank you for taking that role on. Last year, we did have a mask mandate. As Kim mentioned, it worked. It worked really well. We had very few required quarantines. My son was able to finish out the year, the whole second semester, with no quarantines. Hallelujah. We didn't have to do virtual learning. If we forego masks this year with a virus that we know is 200% more transmissible than the original strain, how many times are we going to quarantine? It could be, who knows? I don't even want to try to guess. How many times will parents have to take off work to facilitate virtual learning because their child is under a mandated quarantine and they're not able to go to school because they've had a potential exposure? We're already facing a substitute teacher shortage. How many teachers and staff are going to be quarantined because they've had an exposure? What are we going to do then when we run out of subs, when we run out of people to come and teach our children? How many times will a teacher get ill? How many times will a student get ill? How many is too many? In my opinion, one is too many. I know that masks can be a nuisance. I get it. I don't like wearing them either, but we often have to do things that we don't like. Some people will say that masks can cause you harm, that they can increase the amount of carbon dioxide that you take in, that they can make you sick. According to the Mayo Clinic Health System, this is just simply, it's not true. It's just not true. Healthcare workers have been wearing masks for an extended period of time for years with no adverse effects. There's no risk of hypoxemia or lower oxygen levels in healthy adults or children. and carbon dioxide will diffuse freely through the layers of a mask. Now you may ask, if carbon dioxide can diffuse freely, how is this silly mask on my face going to stop a virus? Well, the studies have shown that COVID is transmitted through respiratory droplets. Masks have been proven to slow the release of those respiratory droplets into the air when someone's talking, sneezing, coughing, singing. What that means is the overall number of droplets is reduced with the more people that we have wearing masks, and this reduces the risk of being exposed to COVID-19. So it's just more masks, less risk. In closing, I will leave you with this. As of July 22nd, 2021, over 4.1 million COVID-19 pediatric cases have been reported. Over 400 pediatric deaths have been reported since the beginning of the pandemic. While this may seem low in comparison to adult deaths, COVID-19 is now a top 10 cause of death for adolescents in the United States. I did provide a handout that has all of my sources, so you're welcome to take a look at that and review those sources. This is all pulled from scholarly articles. It is our responsibility as parents and educators to do what's in the best interest of our children, whether that's an easy decision or not. Sadly, masking seems to have become a political debate. I'm not sure why. It definitely shouldn't be. We should trust in the established institutions that have provided support on disease and health and not get fueled by political rhetoric. I urge you to do just that and to follow the prevention strategies recommended by the CDC, by the American Academy of Pediatrics, and the countless health officials, which is to require masks in conjunction with social distancing and all of the other preventative strategies that I mentioned earlier. I would also like to add that I do agree with Mr. McGee that I believe that particular statement regarding quarantine should be amended. Because the new evidence has come out to show that vaccinated individuals can still spread the disease, I think if you test positive, you do need to quarantine. The science shows that whether vaccinated or not, you can spread that. So if you are positive, you need to quarantine in your home 7 to 10 days with the option of the negative test. So thank you again very much for allowing me to speak. I appreciate it. If you have any questions, feel free to reach out. I know you've got my email, so I am available. Thank you.
Thank you, Sarah. All right. We appreciate the time and effort that all the presenters have taken, as well as the rest of you who've come to listen and to support whatever side that you're on. As you can see, there's a lot of information on both sides. So we will take all that into consideration. We have so far. I think last year is proof that we are most interested in all of our decisions in keeping kids in the classroom, because that's where they learn the best. So we plan on doing that, whether the decision that we make tonight or next week or the following. I would expect that what decision we make tonight will probably not hold for the entire school year. So we're going to monitor daily, as our administrative team does, as our medical staff does, as the local health folks do, and we will adopt accordingly. Even after the decisions made tonight, we'll monitor that daily. So I guess what I'm saying is whatever is decided tonight is probably not going to be the case and the rules that we follow the entire year. We'll see. Our goal is to keep kids in the classroom and students doing what they do best, and that's face-to-face learning. So having said that, anyone have questions for any of the guests that spoke off the board?
Clarification, if somebody is diagnosed with COVID, they will be quarantined, regardless of their immunization status. Okay? So if you're immunized and you have COVID, you will be quarantined.
Okay, very good. Thank you. We are going to discuss the continuity study, the CS plan, under the report of the superintendent in a little bit. So we'll discuss that. You're welcome to stay and listen to that discussion also. Heading forward with the rest of the agenda, first topic up under 3.0 is approval of consent agenda. So I'll seek a motion to approve.
Second.
Okay. Dale and Jim. All right. All in favor, aye.
Aye.
Opposed? All right. consent agenda. Now we have a curricular presentation. Who's in charge of that? I saw like 8 names. Holly, you taking charge? All right.
Good evening, board. It is my pleasure to introduce to you the librarians at Boone, Lincoln, and Hawk Point Elementary. And this evening we're going to be
Microphone.
Good evening, board. It is my pleasure to introduce to you Mrs. Lauren Presley and Mrs. Nicole Bryant, and they are here to present to us this evening about something near and dear to our hearts and amazing for our students in future-ready libraries. Hi there, I'm Laura Presley, and this is my amazing colleague, Nicole Bryant, and we are the librarians for Boone, Lincoln, and Hawk Point. First, we want to thank you for having us here today to not only talk about what we've been doing this past year, but also what we plan to do in the upcoming year. We are both Troy alumni, so we have a special place in our heart right here in Troy. I've had the privilege to grow and learn from other surrounding districts, but I found that my joy is right here in Troy. While I was working in Winslow School District, I had the first-hand experience of working with students who had the privilege of having a computer foundational class as well as a library class, and the benefits that it brought with that.
However, if there's one thing we've learned from our colleagues in this district, is that if there's a will, there's a way. And in our 3 amazing schools, our principals helped us find a way. We brought this crazy foreign idea to them this past year, and it was to look at the library differently. To help us librarians create this future-ready library space. A space that will not only inspire readers, but will also create lifelong researchers, thinkers, builders, out-of-the-box thinkers, and collaborators.
It may not have been done in Troy yet, but the idea of changing libraries is growing in popularity nationwide. Back in grad school, I actually found this TED Talk that is probably one of my favorites of all time. This is Michael Baroot, and he is a graphic designer. And he was asked by Robin Hood, this program, to renovate schools, and he was asked to renovate and revamp this New York school system.
And while they didn't have funds to renovate the entire school system, they decided they had to choose one room that would make the most impact in all the schools.
So they chose the library. And by renovating the library at each school, they can improve the lives of all children inside due to the fundamental nature that the library is the heart of our school. It's the central hub. It's where all students go. And like any change, not only did Michael Baroot discover a phenomenon, but we did as well. If you've never heard of it, it's called the law of unintended consequences. It's incredibly popular. Academic papers are constantly written about it. And honestly, it's incredibly unnerving. Because as educators, we like cause and effect. We like intended consequences. We like knowing our specific actions create specific success. So this phenomenon can kind of be, for lack of better terms, fearful or even create surprise. So to best be prepared, informed, and motivated, we eliminate those unintended consequences the best we can.
So last year, after discussing, deciding, projecting, collaborating, our libraries began a merger into Library Media Tech, where we not only teach library skills, but we also build instructional partnerships, empower students as creators, integrate curriculum, teach 21st century skills, and lead beyond the Library Media Center.
We met with elementary librarians and we rewrote our library curriculum last year to encompass all these big ideas. We had nothing but amazing support with our librarians in this district. In fact, Nicole and I built this library website for Boone, Lincoln, and Hawk Point. However, it's now the website for all 7 elementary libraries.
And as future-ready librarians, we're hoping to develop a love of library and a love of literature but we're looking at this differently now.
Libraries have changed, gone with the typical library quiet, the stereotype that most people are familiar with. And hello to this example right here, collaborative coding.
And poetry slams,
Digital art design,
Osmo stations,
video game design,
and engineering design and STEM challenges.
Librarians are joining this future-ready movement, this network of innovative and passionate educators. It's found in over 3,400 school districts nationwide, and it's meeting the needs of over 20 million students. To better meet these needs, librarians are what they're doing is calling pushing in. They're pushing into curriculum. They're creating these collaborative, dynamic teams with grade level teachers, providing them more than just resources. And in this past year, Nicole and I have teamed up with grade level teachers to better demonstrate this. We push into their lessons, into their curriculum, what they're learning in the classroom. We collaborate with those teachers, figure out the standards, and figure out the specific set of skills these students need in order to be successful.
For instance, for a third grade writing unit, we pushed into the research component. For students to be experts on a topic, they had to be able to process research. So we transformed our library space into a medical surgical unit where students were taught how to research.
How to gather and synthesize information and use that information for all the units to come.
We also worked heavily with fourth grade teachers this year. Our fourth grade Lincoln teachers came to us and were very interested in the push-in of a librarian and the consequences it could bring about. So when collaborating with colleagues, it was brought to our attention that science takes priority and social studies tends to be embedded into learning and integrated.
And on Evaluate, we noticed that across our 3 schools, there was a strand constantly in the red, constantly below that 10% of student understanding. The Evaluate strand focused on students' ability to use media presentation, to use media tools for presentation. For example, when to use a search engine, when to use a social media post, when to use a blog, which is actually how our blog project began.
We created resources and lesson plans for the students and not only taught it during library class, but would push into the classroom and teach it during open times in our schedules. We also piggybacked this concept for 5th grade after talking more with 4th grade and learning this has been a consistent problem over years. We found out quickly that both 4th and 5th grade students struggled understanding the purpose of a blog. So we had them create paper blogs, where they learn the diverse reasons for blogging, digital etiquette required for blogging, and how to properly respond to peers. Afterwards, we zeroed in on 4th grade and compared the data across our 3 schools.
Students at Boone increased from 6% to 55% student understanding. Lincoln went from 7% to 71%, and Hawk Point went from 0% to 100% student understanding. Across the board, we had less than 10, or across our 3 schools, we had less than 10% understanding. And by the end of this, in 2 weeks' time of pushing, we had over 54% for our 3 schools.
Now this is what we were hoping, and honestly almost expecting. We knew that if we pushed in the classroom, collaborated with grade level teachers, and taught cross-curricular, we could definitely see results. We as librarians can raise this data, and it's what we intend to do.
But at the end of the year, by pushing into the classrooms, we were seeing the students more than just 4 hours a month. We were getting to know them and understand them. We were getting to see their faces. They were getting to see our faces and more than just one space in the school. We could really, truly understand their likes and their dislikes, build a relationship with them, see how they learn, and ultimately, we could be another teacher that they can count on in the school.
But what we didn't expect, in the middle of summer, we received a picture of a 2nd grader's party, a pub theme, because Mom knew he discovered his passion for pubs in the library.
Or when Cornerstone of Troy donated cups and cookies to our school for our poetry slam, grateful for the opportunity to present despite all the hurdles of last year.
Or when a student skipped his recess to come in and work with us, trying to correct his video game design.
And when, at the end of the school year, a very doubtful student, fearful of presenting, came to the library and practiced her poetry with us, dressed up and performed it in our school's talent show. Well, right there, those are our unintended consequences.
And every single day, those consequences, both intended and unintended, fuel our passion to be the librarians your kiddos need from us. They drive us to push into classrooms and change the way students see the library. We plan to make changes, look forward, and pilot a year of pushing in to better demonstrate its effectiveness.
And we thank you for your continual support in helping make our library a future-ready library. We hope you leave here today knowing what our goals are and just how excited we are to be the school's library. Thank you.
Any questions for Ms. Bryant or Ms. Presley? Dr. Height? Well, outstanding job. I love the photos of the kids, especially the talent show. And it sounds like all the other librarians are fully on board as well. So that to me is very exciting and,
Yes.
and kind of where we're headed with our STEM classes too. How does that coincide with their work with science, technology, engineering, and mathematics, Dr. Height?
I would say we're very eager for that opportunity just to see teacher collaboration at its finest. And when you put those brains in one room and you fuel it with passion and then see the excitement in our students, great things happen. And so through our scheduling, we have definitely placed priority on making sure that teachers have that collaboration time so that their passion can continue to fuel their work and do what's best for students.
Good. Thank you. Thank you, ladies.
Thank you.
Looking forward to seeing you next week.
All right, we're going to kick off the presentations, our curricular presentations. So next up, under 5.0, report of the superintendent.
Thank you, Mr. Mills. So in your packet, we included the continuity of services plan. Let's go over that a little bit to make sure that we've updated this. Last year it was called the Return to Learn plan. We didn't think that was appropriate for this year because we were in session all school year last year. We're very proud that we were able to do that. I want to thank our parents, our teachers, and our students for being very resilient last year. A year like no other. I've told people that last year felt like 2 years. That's how busy we were, but we made it, and we were very, very thankful. As you can see, the data too. We get our MAP scores at the end of the month, so we're looking forward to seeing how our students did, student achievement-wise as well. So I won't go over all the acknowledgments. We're going to put this on our website tomorrow for all of our patrons to view. We've forwarded it to our guests tonight, so they would have a chance to preview, just out of courtesy. But certainly want our Board of Education to look over our plan. I'll turn your attention to page, what I have, 6 of 21. Julie, can you? Yeah, it's section 1, mitigation. So certainly one of the things that we tried to do last year and this year was mitigate COVID-19 as much as we possibly could. And so if you look at the Troy R3 student data on the Show Me Strong website today, there were 444 students ages 5 through 19 that had contracted COVID-19. In the last 10 days, there's been 1 to 10 students that are Troy R3 in the boundary zone, but that doesn't mean that they necessarily go to school here in our school system. So our friends in Winfield this past week had 0 students ages 5 to 19. So that's what Mr. Mills was talking about, that we continue to monitor our numbers, and we will do that. We did a daily transmission rate last year. We will continue that beginning August 23rd, August 24th. So this is jump to A, universal correct wearing of masks per approval of the board on May the 26th, 2021, beginning in August, school year August 23rd. Masks will be encouraged but not required. For individuals while on district property, with the exception of district transportation, where masks are required by federal order by the CDC. In other words, we don't really have a choice on masks being worn on buses. That is a CDC federal order, and we're recommending the board that we are going to follow that order. The transportation, of course, is a service that the district provides to our students. We have over 4,500 students that ride the bus every single day, and it's a very important mode of transportation, but we are going to ask our students to wear masks if they are on the school bus. But during the day, we are going to encourage masks but not require them. Physical distancing, certainly last year the CDC came to a 6-foot social distance for students. It was originally 6. One of the words I would use to describe what we get from our the CDC, from the health department, and other entities, is a lot of this changes. It changes at a rapid pace. It changes on a daily basis. So to Mr. Mills' comment, once school starts, we plan to be here every day, and we're going to make that happen as much as we possibly can. Hand washing and respiratory etiquette is very important. We were able to install air filtration systems in all the buildings last year to take care of some air quality, and I'm really happy that we were able to do that last year, so this year we should be able to not have any of those issues. Facilities cleaning, I got to give kudos to our custodial staff. They do an outstanding job. All of our facilities always look top notch and they're very clean. We even cleaned certain restrooms 4 times a day last year, kitchen, cafeterias, buses. We have electrostatic sprayers for all of our schools. We have 82 school buses. Every bus has an electrostatic sprayer, so we can disinfect and make sure that our students are in a safe protocol. On quarantine, to the comment that was made earlier, to Dr. Easterday's comment, we did do a modified quarantine last year after the April board meeting, that if the student was faced with mask, 2 parties mask to mask, there would be no quarantine. We will continue to do that, but if the student is not masked, we will have the quarantine and employ a 7-day, have a negative test, and then on 10 days they can return to school. So we are still working on the quarantine period, and if there are any changes, we plan to bring those to the board August 23rd. We do have a tax rate hearing on the 23rd and a special session for strategic planning are our 2 topics. Certainly, we don't want children to come to school sick. That was certainly a message we sent last year to our parents, and our parents did an excellent job of that. We had temperature scanners for all of our staff last year. We still have those. We have not implemented doing those at this time. But if a child is sick or has a fever, please keep them at home, or any of the symptoms that's listed on, what page is it, Julie? Yeah, 11. Thanks, sorry. Page 12. It just lists the same symptoms that we had last year as far as any type of COVID symptoms. And so, one of the concerns that I had last year was that, one of our parents had mentioned the child being in quarantine. Certainly, we want to make sure that if the child is quarantined or student, we have proper resources and technology. Every student in our district has access to an iPad, and we also have hotspots for every child that needs one. So internet connectivity, if that's an issue, please, as parents, communicate that with your principal, and we will assign a hotspot to your home. Our internet connectivity in our community can be a challenge. Even if you have internet connectivity, trying to share 10 megs cannot be enough. So we're working with the county as well, and Governor Carson is working on internet connectivity, broadband, so that we have better connectivity. But we have hotspots to provide that for all of our children, and if you need it, we will provide it. We're also asking staff not to come to work sick either, and so we've talked to our staff. We'll continue to have those conversations. If staff is COVID positive, we have a form that's required to report that, and of course that employee would be quarantined as well. It's on page 12. We talk about our suspected COVID-19 case. We are doing a 3-tier bus system this year. So at our June board meeting, there was another parent group addressed bus. That last year we had a one-stop bus policy. We have edited that policy to allow for parents and children who are in joint custody situations to have more than one stop. So there's a form that we will have for parents to fill out and be addressed by the transportation department so that we can meet the needs of those children. I don't like when children are involved in those types of situations, so we're doing our best to make the changes as necessary. The board asked me to take a look at that. I formed a committee. Mrs. Sabatino, myself, and some of our principals and education office professionals did that, and we came up with a really good plan. So hopefully that might answer some questions tonight as well. Some schools we eat in cafeterias, some we eat in classrooms. We're trying to deter some of the classroom space eating because of this cleanness. The high school did an excellent job last year of students eating in the mezzanine and then some of our high school students eating in the cafeteria. So we're going to meet the needs of those students like we did last year. The principal will be working with our students and staff to make sure that they know where their assigned areas are. Maximum capacity in restrooms as well will be also part of our plan. And but we want to do things, we want field trips, right? We want kids to have those experiences. So those are things that we're going to work with our parents and our students. We address that in our plan. You'll be able to read that when you are provided the link. I touched on transportation information. Latchkey, of course, is very popular. We continue to want to offer our Latchkey program for all of our students that are a part of that. We have some employee travel restrictions, and we will follow those as well. Lastly, on section 2, what page is that, Julie? 16. It talks about 16, 17, 18 talks about our tier 1, tier 2, and tier 3 instruction. You'll see comments, or you'll see things like Ruler, Bridges, Read 180, Math 180. Those are the programs that we're working with Curriculum and to give our students the best education possible. Every student will receive a free lunch based on the 21-22 school year, much like last year. That is provided by the federal government, and so we're very fortunate to be able to take care of our kids' breakfast and lunch needs. So that will continue for the 21-22 school year. Also, the children that are virtual are afforded the same opportunity with breakfast and lunch. We take care of those kids regardless of how they're receiving their instruction. I think that's I want our community to know that. There are some noted connotations around full occupancy on August 23rd, limited occupancy, and full virtual. Those are things that we certainly want to avoid. We thought we did that last year pretty well. We only had interruption at Early Childhood Center for the first 2 weeks of school. We had about 5 days of interruption at Main Street Elementary, and we had about 5 days of interruption at Troy Middle School just in the 8th grade. Our high school was not out a single day. 9th grade center, Troy South, a lot of our buildings, we had continued services, and we were very proud of that. We plan to do the same thing this school year. Once again, I noted on page 18, the student device and internet access. If you need that assistance, we are here to help at no charge, of course. And in special education, we are here to meet all of our students' individualized education plans. If they have requests for virtual, we will meet those needs as well. We had 72 families reach out last spring that wanted virtual education for this year. We will still honor those requests. Those will be through the Missouri Course Access Program, the MOCAP program. There are about 12 providers for that if people want virtual, but that will be the option, the virtual option for the district. We address the needs of our homeless students, our English language learner students. Our social emotional learning can never be more important than the work that we're doing. Last year, the district hired a director of social emotional learning to meet the needs of all of our kids. We actually also hired additional crisis counselors to be on staff this year to help our students with any type of social emotional need. So we are here to help our kids from day one, and we're prepared to do that. Buddy bags, we'll continue to do buddy bags. Last year we did about 400 a week, and we want to once again meet the needs of our students. We've been doing that since 2012. That is a district-sponsored and community-sponsored program. We have people that take their own paychecks and help our kids with buddy bags. We have parents and community members that write checks to meet kids, help their needs with our Bright Futures program. So we're very proud of our community, how we rally around and take care of our kids. We will have visitor restrictions, much the same that we had last year, and until we see a decrease in our positivity rate, we will keep that restriction. But if you want to come to school, let us know. Yeah, it is something that we're trying to protect all of our staff and our students. We're responsible for 6,700 kids and almost 900 employees, so we think that is a very important task that we're charged with, but at this time we will have visitor and volunteer restrictions. Communication is something that we're working on. We have many parents probably received yesterday a survey called Thought Exchange. I don't know if you saw that. We need help. The federal government has allocated millions of dollars to public schools across the United States, and part of that plan is to get input from parents and stakeholders. Yesterday was our attempt. We received 1,200 responses in one day, and we really appreciate our parents and community members taking that survey, and employees. So if you see Thought Exchange, we'll be using that. We just got that this summer. We'll be using that for more communication methods. Always please check our website. We will have our daily COVID numbers on our website, social media, and then Canvas is a great tool we do at kindergarten through 12th grade. One thing I like about Canvas, and some parents may not know this, but we aligned ourselves with Canvas about 4 or 5 years ago because many of the higher ed universities, Mizzou, St. Charles Community College, Missouri Baptist, they have Canvas in place. It's a seamless transition for our kids once they graduate from New Horizons High School or Troy Buchanan High School. At this time, Board of Education, that is our presentation of our continuity of services plan. Any questions I could address by the board?
Questions or comments on the plan as presented? I know we've all had a chance to review it. Questions, amendments? We do need to take a vote to approve as presented if there are no corrections. So, seeking that motion.
Second.
Okay, Mr. McDowell and Mr. Siebert, first and second. Any further discussion? All in favor, aye?
Aye.
Opposed? All right. 5.02.
5.02 tax rate hearing, I referred to that in our previous bullet point, set for August 23rd at 6 o'clock in the Board of Education room, it's in the Lincoln County LCR3 Central Office Building. And then following that, we'll have a strategic planning session. This year, we are required by the state, of course, to have a 5-year comprehensive school improvement plan revised, and so we'll be doing that, both tasks on August 23rd. 5.03. Emergency exit proposal. So myself and Dr. Culbertson would like to update the board and let you know kind of an idea that we've worked with the City of Troy, Lincoln County Economic Development, Lincoln County Emergency Management, and MoDOT regarding a exit proposal for Troy Buchanan High School. So as beautiful as Troy Buchanan High School is and has been for well over 27, 28 years, the new high school is almost 30 years old, believe it or not. We're concerned about one way in and one way out. And so the community is concerned, not just the schools. So that's, and Mr. Stanek is here tonight. I really appreciate Adam's lead on this, being our emergency management director, and Julie Rogers, economic development, and Mayor Ron Scotts. We had a great meeting, and so let's look at the conceptual plan. One of the ideas is to propose to MoDOT to put a road behind the tennis courts at Troy Buchanan High School to connect to Highway 61 that would only be used for emergency vehicles only. And we're concerned about access. If I ever leave Troy Buchanan High School about 2:30 in the afternoon, it's hard to get in, it's hard to get out. And so that's our concern, that emergency vehicles would only have access to this gated road. It would probably start out as a gravel road until we can come up with more funds and more. But we have to have MoDOT's permission even to be able to do that. So I would like to propose that to the board. So that is one drawing that we have. You see, it's right behind the tennis courts. And then the other conceptual plan, is that the same one, Julie?
No,
It's different. Yeah, it's different. It comes down a little longer. So Dr. Robertson's worked with our engineers. Both of these, basically, we would pitch to MoDOT to see which one that they would accept. And we would be responsible for the cost. But we think it's well worth the cost to be able to have emergency exit only for our first responders. We will also visit with Sheriff Harrell and with Chief Taylor once we get this approval before we go to MoDOT. That makes sense. Any questions on the proposal? I would ask the board to approve a motion for us to move forward with this proposal to MoDOT.
So moved. Second.
All right, first by Randy, second by Doyle. Okay. And the only difference is we'll seek MoDOT's recommendation on which of those two plans will be. So, all right. Any further discussion? All in favor, aye?
I want to thank Adam once again. When he came on as emergency management director, that was one of the things that he said he loses sleep at night, and I echo that. And ultimately, we would love to find a way to connect our property and a roadway through South Lincoln Drive and to possibly Highway 47. So we had some students present that a few years ago. I thought that was pretty neat in that presentation, and so that was kind of the. But I do want to publicly thank Mr. Scott, Mr. Rogers, Mr. Stanek, and Eric Menigo from ODOT. Thanks for being here, Adam. 5.04, we have a district profile called Schoolzilla, not Godzilla, but Schoolzilla, that Dr. Grider is going to talk about and help us with really good metrics that was mentioned earlier and student data information. Good evening, Dr. Grider.
Good evening, Dr. Penny, members of the board. Less large. No? That's okay. Yep. So tonight, appreciate the opportunity to share some information with the board. Schoolzilla is a virtual dashboard that the district is going to start to use to monitor specific metrics around achievement, attendance, behavior, really the business of our business as a school district. So you may remember me mentioning a new partnership with Renaissance, that our STAR math and STAR reading assessments that we're using as universal screeners. That's a new partnership this year we're also excited about. But as part of that agreement with Renaissance, we have begun a process of utilizing Schoolzilla to bring information into a one-stop shop for us to be able to monitor some of those critical metrics of a school district. You may have noticed in our continuity of services plan a discussion around Tier 1, Tier 2, and Tier 3 instruction. And really a focus for us this year is around Tier 3 interventions. So those things that we do in a school to support our most at-risk students, both in their academic achievement as well as their social emotional health. So some of the metrics that I'll show you guys tonight in this quick tour of the dashboard are going to be metrics that I'm going to bring to you every month so that we can have this ongoing dialogue and keep the board updated on those things, again, that we find most meaningful to measure. Our strategic planning process, which will kick off in a couple weeks with the board, with Dr. Van Leer, we'll be using Schoolzilla exclusively to monitor some of the goals that we're going to set through strategic planning. So we're also excited to incorporate Schoolzilla in that way as well. So there are some screenshots that are in board docs that kind of take you through the tiles that we are monitoring. This is a live look at the website. If you care to look at the screen, just want to show some of the features and certainly open to answering any questions that the board may have. So some of these tiles are pulled from our student information system and they are updated nightly. So any new information that goes into Tyler SIS is pulled into Schoolzilla and is updated on a daily basis. There are some things that are a bit more static, like enrollment, but they are nonetheless important to monitor. So as I go through this culture and attendance grouping, you'll see that we have enrollment, our average daily attendance percentages, and this is based on last year's data. So as our school year progresses, the data from this school year will populate, and we will be able to measure. So you notice that, for example, our average daily attendance rate last year was 95.3%. That was almost a full percent higher than the year previous. You'll also notice in the top left-hand corner of each tile, there are district goals that have been established. So it's important that while we want to celebrate improvement, we also know we need to continue to grow. And so this is a way for us to monitor progress and also set goals to achieve each year. 90 for 90 is another important metric for attendance. It is part of our MSIP accreditation process. So 90% of our students attending 90% of the time. That looks different than ADA, than average daily attendance. We had 92.2% of our students attend at least 90% of the time last year. That was up from 1920. And again, you can see a district goal has been established to see that goal continue to move in the right direction. So there are several tiles, again, in this section that we monitor. One of the ways we're also able to take a deeper dive into the data is through some of the features here that you'll notice on the bottom and to the right of the tile. So for example, one thing we're able to do is look at multiple years. So we can pull in not just 2 years, but we can look at 3 or 4 or even 5 years worth of data. And we can adjust those results and look at them in different tables. We can filter by grade levels. We can compare by particular demographic information. So there's a way that we can really dig into this data that's very quick and at our fingertips and allows us to really, again, closely monitor some really very important metrics of the school district. Office discipline referral count. Again, something that this is at the district level. We'll show you here in just a minute how we can drill down to building, to teacher, to the student level with all of this data. Again, these are all metrics that create a profile of every student. And when we talk about those kids that are the most at risk, we are able to create groupings of kids that are hitting these at-risk categories and allow us to really individualize support for students based on the conversations that our school improvement teams as well as our intervention teams are having at the site level. I'll skip down to our academic section. And again, I'll just mention that the data that's populated in here regarding MAP and EOC is from the spring of 19. So our spring of 21 data will be in here eventually once that data is made public by DESI. But again, we're able to track performance over multiple years. We can dig into and look at trends. Again, this functionality here at the bottom allows us to look at different categories of performance. It allows us to look at and track our performance over time. This data, again, for MAP and EOC is really autopsy data. So the school year has passed. There isn't much we can do about this data right now other than admire it. But the part that we're really excited about, and I'll scroll down here farther, is how we're going to use our STAR data. And you'll notice that, again, this is under the academics and reading section, but we're able to go in and early literacy assessments that we'll give to our kindergarten and first grade students. We began utilizing some of this last year and piloting it. We'll be able to dig into this as we give the STAR assessment 3 times a year. We'll be able to understand the trends of those assessments and how buildings will use that with those results to create intervention groups and target specific support for students. The STAR assessments are available for our Spanish-speaking students, and so for our ELL population, again, this is a way for us to target and intervene. A couple of ways that we're able to really look at how are we doing compared to students around the country or students at specific grade levels. How do we compare in our growth? That's where something like this early literacy growth percentile allows us to look at the performance of our kids and compare that to students across the country. But also, it allows us to look at this district benchmark percentage, which creates a prediction of how our students will perform on the high stakes tests at the end of the school year. So there's a lot of good information that we're able to glean from STAR in reading that tracks growth of kids, but also projects how might we expect them to perform on the high stakes test that they're taking at the end of the school year. So again, this data is not populated with the most current data, but as we get kids back, as we do our universal screening at the beginning of the year, as we get our MAP and EOC data populated in here, we'll be able to bring those updates to the board on a monthly basis. Another component of this is something called the Accelerated Reader. And so this is a tool that all of our schools will have access to get high interest fiction and nonfiction into the hands of our kids, utilizing their iPads, and be able to track how much are they reading. We can assign kids high interest reading based on their reading level. But again, the goal here is to increase the frequency with which kids are reading and then measure their progress of their reading levels throughout the year. So we're excited to be able to use a tool like Accelerated Reader and be able to track our students' progress throughout the year. Same thing for math. I won't spend much time in this section, but just know that we have similar metrics in math, both for MAP, EOC, STAR math. We'll be looking at and digging into those. And again, our first round of reading and math with STAR, which is replacing Evaluate. So you might remember Evaluate assessments from years past. STAR will replace those. And as we update the board on the progress of the district, we'll be looking at those assessments in STAR. Social emotional learning is another component that we're excited about to be able to track with Schoolzilla. So not only do we have academic assessments, we also have DESA, which is our social emotional universal screener. We received some training during our summer leadership meetings a few weeks ago. Dr. Salvo has led a group to select a vendor, DESA, that will provide a universal screener to really target those kids that are showing those trauma factors that we need to identify and provide support for. And so this will be a way for us to track the mental health of our students and the ability of us to provide specific support utilizing some of the new resources that we have in the district that we're very grateful for. So again, the DESA is a tool that we're using to monitor social emotional health of our students. And again, that's information that we'll be adding into the system as the year moves on.
Dr. Greiner, how is that
Yes.
tracked? How do you put that information into this?
So there is a screening tool that's questions that students answer, and it starts with the mini DESA. There are, I think, 8 questions that students respond to, and based on those responses, if a student falls in a high-risk category, we follow up with the full DESA to get a better handle on what traumatic events have they been exposed to, or what type of mental health concerns are they telling us based on that DESA
And how
screen.
will we encourage them to use that?
So based on the information that we get from the DESA, our building intervention teams, our mental health professionals will use that information to either form small groups, to meet one-on-one with those students, to reach out to families, to begin dialogue around resources that we might be able to provide them either at school or
But
in
that's
the
when we
community.
have the information, right?
I'm sorry?
That's when we get the information.
Correct.
My question is, how do we encourage the child, the student, to actually
Be honest.
be honest and
Yeah.
funnel them to this tool?
So part of the training that we got on the DESA screener includes some talking points. It includes some ways in which we can attempt to engage kids. Part of this is getting them with adults that they trust. So for example, at the elementary level, conversations that they're having with their classroom teacher, there are ways in which we want to build that trust with students in a safe environment for them to answer honestly. DESA also picks up on maybe some, I would say false positives or answers that they may not be necessarily entirely truthful about just based on the algorithm of the screener. So there are ways that we want to help prepare our staff to give and encourage our kids to be honest, but also we know that the trusting relationships that they have with our adults are a big part of our students being willing to share how they feel. Dr. Salvo, if you want to add anything there. And then the last section, board, college and career readiness. So we know ultimately our goal is to have our kids college and career ready when they leave us from either Troy Buchanan or New Horizons. And so there are some specific metrics that we will be continuing to monitor. Course failures, certainly something we're very interested in and concerned about. As you can see here, this metric, we saw a marked increase in fourth quarter course failures compared to the 19-20 school year. Those are conversations we are having with our high schools and school improvement teams to really target how we can help kids be more successful in those, specifically those core courses that they need to have success in college or in life after high school. So again, these metrics are things that we are taking a close look at. GPA, on track towards graduation. So this is a metric that we don't have the 2021 data in yet because the 21-22 school year hasn't started yet. But that is certainly something that we are interested in tracking, is the percentage of our kids that are on track to graduate. We have a very strong graduation rate, over 96%, but how our kids get to graduation is something we're really concerned about. And how many times do they have to repeat classes, or how often are they in interventions? How good is that first best instruction? Those are things that we really need to improve upon. And a metric like this, I think, can allow us to really drill down and see where are our students having the biggest struggle with staying on track to graduate. Obviously, the ACT is an important benchmark assessment for success in college, and we are interested in continuing to see all of our students college and career ready. And that indicator right now is to be college and career ready is to have an ACT composite above 21. And so we want to see that number continue to grow, and so that'll continue to be a metric that we will measure. So again, I apologize for the long-windedness of this, but just wanted to give the board a quick snapshot of the Schoolzilla tool, and know that we will be coming back to the board with updates as we see this dashboard continue to include our most current data. I will mention also, we are able to look at reports that compare schools across the district. So again, there's some PDFs in your board docs, but there are ways in which we can look at and compare all of these metrics across schools, and we can rank them. Again, look at performance comparatively. There's a way for us. Each school has their own profile, and so that with those same tiles, that same data, we can drill down to the school level. So everything we talked about, all those different tiles are available at the school level. And one of the things that I think that's very powerful, and I won't pull it up because it will have some identifiable information of our kids, but at the student level, we're able to see all of those tiles and group students by at-risk categories to know who are those kids that need our support right now, that our intervention teams have to respond to the first day of school. We cannot wait. And so our schools are very excited to be able to have the opportunity to know specifically and strategically how to better support our kids with interventions. And this is a tool that's going to allow us to do that. So we're very grateful for the board's support to provide us the access to a tool like this. We think it's going to be transformative. So happy to try to answer any questions the board might have at this time about Schoolzilla. One word to say.
Thank you, Dr. Greiner. Thank you. Next, 5.05.
Policies and regulations, first read. Policy 4505 and policy 4506 regarding personnel services. I want to thank Mr. Schminke and Dr. Levy for their work on the red edit. I would say the red ink has been used. It's really to take an antiquated policy from 2012 to 2021 is basically what we wanted to do. So If there's any questions that you have for Dr. Levy or Mr. Schminke, please ask those now, or between now and at our September board meeting, we would ask the board to approve policies 4505 and 4506 under really just compensation. Adding the doctorate, we asked the board to do that this past year, Dr. Collin, to address the teachers that have received a doctorate degree and some of those types of things. Hiring bonuses, we're looking for bus drivers and other employees, paraprofessionals, and Mrs. Schmink is going to give that report in just a little bit. So any questions on first read of those policies and regulations? 5.06, our central office administrative team report out. And Mrs. Schmink, we'll start with you.
Good evening, board. We have been very busy with continuing our hiring and onboarding process. We are fully staffed with our certified staff, so we do have all of our teacher positions filled right now for the beginning of the school year, and had the opportunity to meet with our new certified teachers these past 3 days, Monday and then last Friday and Thursday. We met with 84 new teachers to the district and just had a wonderful opportunity to get to know them and share with them about the district and help them get up to speed and ready to start the school year. We will continue with our new employee orientation on Friday with our new classified staff members. We currently do still have some classified positions open. We have more needs for paras this year than we did last year. We do have 27 para positions currently open, in addition to some transportation positions, PAT positions, and latchkey positions. So we will continue our recruiting efforts to look for those right people to join our team and serve our students. Additionally, we will be working on the grant process for the teacher recruitment and retention grants that DESE has made available. There is an application process, and so we will be beginning to write those applications to take advantage of those funds. And that is it for right now. Any questions?
Ms. Hennebrink?
Good evening, board. First and foremost, I just wanted to thank you for your support through the last month. My family had an unexpected tragedy, and it is so relieving to work for an organization, a board, and a leader that know when family needs to come first, it absolutely does. And so thank you so much. And also thank you to my support staff, Shay Layberry. She stepped in and just rocked it while I was gone. So I felt like that was really important for that to be said. That being said, we have a lot going on and a lot of things to ramp up on. We did work on the continuity of services plan and working with Dr. Levy, as Dr. Penny had mentioned, through the thought exchange process. And so we onboarded Thought Exchange. It's a new community engagement tool that we talked a little bit about earlier in the summer. We're really excited to see how that can give a voice to all of our community members and stakeholders and help those conversations continue and drive the big pieces of things that we're getting ready to do this year, including our strategic planning, our academies, and those types of things as well. Just a little bit of an update on, excuse me, the one that we sent out yesterday. We've already had over 1,300 participants in that thought exchange, and of those, 874 have provided thoughts. So they have engaged with that already. We're really excited to see how that helps us drive that question about that funding for ESSER, which you saw in the section 3 in the continuity of services plan. Additionally, we're working for the welcome back. We're looking so forward to welcoming our employees back next week, and then of course our students on the 23rd, working with Dr. Penny on what our welcome back day on the 17th will look like. That will be a virtual presentation again this year. We did not feel it would be prudent to put all of our employees into one space again, just with social distancing and such. And so we're looking forward to celebrating our Teacher of the Year on the 17th. We do have our Teacher of the Year dinner the night before, so we'll celebrate all of those finalists, including our star employee finalists, and we'll announce our star employee on the 17th as well.
and also the Shoot for the Moon, which is an academic award. And so we'll be looking forward to honoring a group or individual with the Shoot for the Moon award. And then going forward, we're just working towards preparing and scheduling annual communications. We have a number of different things that go out just on a scheduled basis, and so we're working towards making sure that's updated, getting our website cleaned up and dusted off for the school year, and so forth. A couple of things on our report from this month. Some social highlights. You noticed that some of our social did go down in the month of July. For one, I was out, and two, that is usually just a time where we see a natural dip anyway. Summer school's over. We don't have a lot that we're posting on those pages. However, we did have our hiring night that Mrs. Schmanke's department hosted was a big hit on Twitter, where we see a lot of our professional communications and different shares for those professional relationships. And then also on Instagram and Facebook, our folks were very eager to celebrate Mr. Eric Blankenship, last year's Teacher of the Year, as he was designated as one of Desi's Regional Teachers of the Year. And so we look forward to hearing how he moves forward in that state competition. Thank you.
I was going to say, thank goodness for Mr. Blankenship in July. He increased our social media traffic. Thank you. Ms. Sabatino.
Good evening, Board. We've spent the summer preparing the buses, doing our PMs and regular maintenance, doing deep cleaning on everything. We did get word that our new bus purchase, our 8 new buses that we're waiting on, will be delayed. We anticipate their arrival on probably at the end of October now instead of August. We've spent a lot of time on recruiting and hiring. We've added to our maintenance staff, we've added to our EOPs. We're still looking for a maintenance fleet supervisor, which I interviewed for that this evening. So we're making a lot of progress on our hiring. We still have driving positions open and monitor positions open. We are preparing for our annual kickoff meeting, which will be this Friday. We'll have TSA, Transportation Security Administration, will be our main presenters for the meeting. Other than that, that's what we're focused on, and we're excited to be back. Thank you.
Dr. Levy?
Good evening. It's been an amazing month in the finance department. First, we started something different. As the office staff, we visited with all of our administrators throughout the district at Admin Week. We've also visited all of the new teacher meetings that Ms. Schmanke's team has put on. That allowed us to get in front of the staff. It allowed us to explain what our department does, help them with any concerns they might have. It also puts a face with a name that allows them to begin to understand who we are and better connect with us as a group. So, in addition, I've been working with Todd very closely and Connie on the Emergency Connectivity Grant. The government released $7.7 billion. So we really took a step back and thought deeply about how we could use those funds to support student learning. So through the process, we've put in requests for iPads, for additional data through Kajits, which are basically hotspots that allow us to use multiple phone service providers and support our students, and then also we'd also ask for additional data to make some of our iPads actually have hotspots enabled within them. Now we can use those. So altogether, we put in for about $2 million worth of requests, and we'll wait to hear on those. And hopefully, the window closes the 13th, so hopefully that will hear soon what we qualify for. Other than that, we have done some training on SysSpin Pulse. It's a program kind of like Schoolzilla, but for the finance department. It allows you to quickly pull reports, look at real-time data. Our goal is to give access to that to all of our administrators so they can see budget codes that they use and also track purchases, understand what's going on. So we want to do that. I've also been able to serve on the Dolly Parton Library Committee. We are slowly phasing that back to our district from United Way, and so we're looking for fundraisers and ways to make sure that we continue to put books in our children's hands. And then, other than that, I'm working closely with our auditors. It is that time of year where We continue to provide them documentation for their on-site review in September. Any questions? Thank you.
Thank you. Dr. Salvo?
Good evening. I'm so excited for school to get ready to start. I'm so looking forward to seeing the hallways filled with kids and teachers. There's an energy about it that is just unexplainable. So I'm so looking forward to that. There's been a lot of prep this summer to meet the needs when kids come back, and I just want to commend the work of our building leadership teams, our school counselors, and so many teachers that worked over the past 6 weeks to attend ruler training virtual that's out of Yale to meet the needs of our kids when they come back. It's an SEL curriculum that is new to us, and I just want to say a few words or vocabulary words, and throughout the year I'll go into more depth on them, but just that's one of our goals this year is to have a universal kind of language across the district, whether you're in early childhood or a senior, that some of these tools that we're equipping our kids and our faculty and staff with, it doesn't matter what school you go to, we all have the same. So over these 6 weeks, they've learned a lot of things about emotions matter. They've learned to name it, to tame it. So getting to the root of why we might be feeling some way, and then how to cope appropriately with that. They've learned about a mood meter that helps us recognize and understand and label emotions, a meta moment that has taught us how to pause before we just react, maybe in a way that's not our best self, as well a blueprint that we'll be learning about the rest of this year, which is almost a restorative practices piece. If there is a conflict, how do we handle that appropriately? And get to the root and have voice on both sides. So I'm really looking forward to this year, and I just want to commend again the teachers that have done this training 6 weeks over the summer, and our administrative team that they juggle so much, and to put SEL at the front, which I say is the front. I just appreciate and I want to commend them for their work. Thank you.
Thank you. Dr. Culberson?
So, Board, I'll start with elaborating on something that we discussed earlier in the meeting. The 2 versions that you see in your packet are really versions for estimates, because each has its advantage over the other in terms of price and as due to topography, because the angle of the highway along that western side of our property is very steep. And the other version, not this one, brings that entrance exit down quite a ways to the south, which would not require as much fill. And also the power lines come into play here because they're very low to the ground.
Not as close to that exit ramp, too.
And MoDOT will determine how close from the exit ramp that they're going to tolerate. So each one will be evaluated on its price. I do envision this to be a gravel road to begin with. Let me back up. The other advantage to these 2 versions is we balance the aspect of providing an entrance exit to the property, but not sacrificing any of the playing fields nor parking spots. As you notice, we come into the cul-de-sac at that corner, which means we preserve the parking spots. So we might have to take out an old ratty tree, but that's really all of that and some dirt excavation. But the gate, let me talk a minute about the gate up by the highway. That's going to be engineered to be a knockdown gate for emergency vehicles only, as they need to get in. Again, this is provided because of the dangerous situations that schools face these days, and they're going to come in, and it'll be locked at all of the times. So wanted to mention that. Beyond that, our crews are just, with the 23rd approaching, they're scrambling to put last minute touches on all of the remodeling projects. They're You know, that's been a diverse set of trades that we employ with our group. Painting, remodeling. We remodeled 11 classrooms at Troy Buchanan High School this summer, including cabinetry, casework cabinetry, painting the floors, and painting the walls, and they look great. All of our buildings' floors look great right now. That's one of the first things you see when you walk in, that brilliant shine. I think it's something to be proud of. But they deep clean every classroom in the district, and just want to mention that's maintenance, custodial, grounds, and technology. They're all part of the plan in the summertime. As far as construction goes, I would characterize our construction projects as making steady progress. No, in the last 20 days, no significant delays of any kind. We know that the wall panels are delayed at Rankin till the 19th of this month. They should arrive on the 19th, and then we'll see those go up. But what you're seeing right now is a lot of work inside, thank goodness, and that includes the walls. All the steel framing for the walls are going in. Once the wall panels go on, then the perimeter, inside perimeter can be installed, and it'll really fly. But we're still in September, well into September with this project. Computer services trails the Rankin project, because it started a lot later, but steady progress would characterize that as well. We are experiencing delays in materials, almost every aspect. I mentioned this last board meeting. We're starting to see a little bit of employee illness, COVID related on the Rankin side. There's one trade that's experiencing some problems, but we'll work through that, right? Thanks.
Thank you. Dr. Grover.
Good evening. I used to tease Dr. Connor that he had too many binders in his office. Well, guess what? I have binders now. Lots of them. So you guys
read
have
that to us, are you?
What?
Can you read that to us?
Yeah, all 122 pages or however long. You guys have a copy of the local compliance plan that we have to approve and send to DESE. So it follows the Missouri State Plan for special education, and it's basically us as a district saying that we're going to follow Missouri's plan that they base off of IDEA. The only thing that we really need to decide is on page 34, and it is the eligibility criteria. The eligibility criteria for children ages 3 through 5, and we would want to select the last one, which is identify all children as eligible using all disability categories other than language impairment, which includes young child with a developmental delay, that's YCDP. So the purpose of that is that it'll help us with a district our size. We want to select that one because it's going to help us identify all children with different disabilities and not limit those at all. And then the second one is for children that are kindergarten eligible. So the state has you decide if you are going to allow 5 and 6-year-olds to go into kindergarten with the disability category of a young child with a developmental delay. And we would like to do that because there's a lot of times that we have kids move on that we're not quite sure what category they would fall into, and it would be doing a disservice to them if we send them to kindergarten without special education services. And then the next thing that's a no-brainer is on page 94. And it is us just declaring that we are going to use the public agency to coordinate with the National Instructional Materials Access Center. So this is basically for students who are blind. The DESE allows us to coordinate with this center, and we get a lot of materials for free. Tons of materials for free. We had a student who was blind at early childhood, and every month it was like Christmas. We just get all this, like books in Braille and all this, these electronics and everything for the students. So of course we'd want to do that. The other check mark means that you pay for it yourself. We don't want to do that. And then everything else is compliance, that the special education department keeps up with, and make sure that we're compliant with all students with an IEP. So we just need to approve that and then send that on to DESE, I think, by the end of September. And then as far as other things that are going on, Latchkey has an enrollment of 257 students district-wide right now. 125 of those are staff students, or staff children that are going to Latchkey. Latchkey had their welcome back, or has their welcome back this Thursday, and we currently have 2 new staff members, but we have 7 more to find. So that's, Mrs. Mickey had said something about Latchkey. We're needing 7 more Latchkey members, staff members. Special education, we have this Friday, we have a new special education teacher welcome back, or welcome. They're not coming back, so just a welcome. We're gonna focus on training them with mostly IEPs, how to work with regular education teacher, and then a lot of compliance. This year, a big focus for the special education department is going to be on training both special education teachers and paras, so you'll be hearing a lot about that. And then I also met with Linda Kirkpatrick of Innovation Options last week to go over our Medicaid reimbursement and how that works. And she made us aware of a new state program called cost-based rates that will allow us another avenue to be reimbursed for supplies and services for those students who require materials and services that exceed the amount of a typical student. So that's another way for districts to get some money reimbursed for those students. So we're excited to hear about that. We're still learning all about it. It's very complicated, and so we use her to help us with that, with all of that billing and reimbursement. And we did receive $14,314 for last year as reimbursement for Medicaid billing from the direct Medicaid billing program. Thank you.
Thank you. Dr. Sally?
Good evening. The past time period since I've been last able to speak with you has been taken up a lot of time with professional development so we can train our teachers to be the best they can be when our students come back. One of the first pieces that Dr. Salvo and Dr. Porter and I did together was getting our new teachers together with their mentors and training the new teachers in some best practice in regards to instruction and to also inform them more about trauma. We also had Carnegie Learning training for our Algebra 1 teachers, and I appreciate both the administrative support and the teachers that spent the day with our consultants so they can be ready and prepared to teach that math. We also spent some time learning about our Tier 3 interventions, and training the teachers in Read 180 and Math 180. Those are programs that will really hone in on the students who are 2 or more grade levels behind in reading and math. Earlier last week, I worked with biology teachers. They rewrote their curriculum last year, and we spent the day together to review what first semester will look like. And it was really a rewarding experience because we had 3 new biology teachers there. Probably the most exciting piece that I was able to be a part of that was led by Lori Horner and Jennifer Orton was the Vanguard 2-day experience for secondary educators. We had a 2-day experience for our elementary teachers as well. Vanguard is all about technology and using it to reach kids in different ways so we can reach them at higher levels. We looked at creativity, collaboration, communication, and critical thinking, and how to use technology as a vehicle to get our kids higher up at those levels for 21st century thinking skills. Thank you so much.
Dr. Griner?
Mary, I'm disappointed you didn't say your most exciting work was anything having to do with hanging out with me.
It's all been really wonderful.
Thank you, Mary.
It's understood everyone.
That's
I thought
a
I
given.
just conveyed that every time.
That's another binder.
It is. The whole office dedicated. We're excited to kick off strategic planning, as I mentioned earlier, at our tax rate hearing in a few weeks. So Lori Van Leer will be joining the board after dinner to start a visioning process with the board to think about what the next 3 to 5 years we want to look like in R3. And so we're grateful to have Lori with us and excited to engage the board in that discussion. Career Academy, a lot of things happening. We're excited to sit down with our high school teachers and counselors next week to talk about our targeted industries alignment. Essentially, that's a document that's going to help us name our academy themes as we're moving closer to that. So again, excited to get more input from our teachers and counselors to guide our work towards master planning, which starts in September. Appreciate Julie sharing that invitation with all of you to join us at the Factory on Cherry on September 15th, November 10th, and January 12th, as we really dig into the finer details of what career academies are going to look like here in R3 starting in the 22-23 school year. We are kicking off our freshman academy at the 9th grade academy, and you all have been invited to join us for our commitment to graduation plus ceremony. So not only are we interested in our freshmen thinking about graduating from high school, but we want them thinking about graduating with a credential, some type of advanced credit, what's going to get them ready for life beyond just high school graduation. So they're going to make a commitment to doing that on the 27th, and we hope that the board might be able to join us for that ceremony to celebrate their commitment. One last thing about career academies, we've discussed a potential visit to Belton, Missouri, and we've targeted the week of September 27th as a possible week to visit Belton. So I'll be following up with Dr. Penny on some of those details, but board, if you could please take a look at your calendars for that week and maybe identify, is it earlier in the week that would work best if you're interested in going, or the end of the week. But we'd like to take a road trip to Belton, Missouri and experience the academy model there. They are a few years ahead of us, and learning from their experiences, talking with job-alikes, board members, teachers, principals, to really get a feel of what that implementation's been like in another academy here in the state of Missouri, I think would be really helpful. So I'll follow up with Dr. Penny on that, but we're looking to travel to Belton sometime the week of September 27th. Finally, I just want to shout out our principals. A lot of hard work this summer to bring together their staff to get ready for the school year. Their school improvement plans they are working on, to get to my office by the end of the month, and they are just a phenomenal group of leaders. We are very blessed to have some of the best principals in the state. They're a pleasure to work with, and I appreciate all of their efforts as they're working hard to get their school improvement plans ready to go for the 21-22 school year. Thank you.
Thank you.
All right, thank you folks for all the updates. I know even though we've had summer, folks are working pretty hard to get ready to rock and roll, and it's upon us, right? So next time we get together, we'll be school already in session, so I look forward to that. Anything before we adjourn and go into closed? Once again, thanks all for attending and for the information that you've shared and for your interest. I will seek a motion to go into closed session.
So moved.
Randy and Dr. Easterday, all in favor, aye? Opposed? Okay, take a brief recess and go to closed.